Hello, my name is Dr. Marcus Smith, and today I'm going to be going over how to set up subcutaneous fluids. We often use fluids to treat cases of dehydration, and also we use it in the management of kidney failure in cats. Okay, so we're going to start with the components. Basically, a fluid bag, most commonly used is saline and lactated ringers, an extension set, and a needle. So first, what we want to do is we want to take the extension set. We want to roll down this right here, okay, and roll it all the way down to where it's snug and it's stopping the flow, okay. Next, what we want to do is we want to take this right here from the fluids, the plug, pull it off, okay. Next, we take this end of the extension set and insert it into the end of the fluid bag, okay. Following that, you want to go ahead and give this a few squeezes, filling it about halfway. Now, again, you've done the roller and you've stopped the flow of the fluids. So, as aseptic as you can be, you take the needle, put it in. Okay, now, very carefully, you undo the roller and you watch the fluids as they go. And they will run through. And as they run through the line, just before they're about to get to the syringe, you stop it once again. Now, how to get fluids, we want to hang it about 3 feet above the patient. So if you have something to hang it with on a pole, or having somebody help you is extremely beneficial. So how much fluids do you give? Well, typically it's between 100 and 300 mils in a cat, and that's about the average. Again, talk to your veterinarian about what they recommend. They may adjust it from time to time. They may also adjust the frequency of how much you give it. Okay, so where to give it? Well, usually it's between the patient's shoulder blades, so just below the area of the neck. Okay, and when we give that, we hold it in the skin, put it in under the skin subcutaneously, get subcutaneous fluids, and then we let go of the roller and it starts. So, again, that's how we do it. Following that, we go ahead and once you're done giving that set amount, and it's very clearly marked on the fluid bag, 100, 200, so you're going to just start going down, okay? You stop it, pull it out, you take off the old syringe, you put on a new syringe, and you're ready to go for the next time, and there's minimal bacterial contamination. Okay, so that's how it's done. All right, and what we'll do is we'll get a patient in here and we will go ahead and demonstrate exactly how it's done. Okay, so what we're going to do now is demonstrate how to give the subcutaneous fluids to our resident cat, Julius here, and Jason, one of our technicians, is going to be holding him. Sometimes it's a 1-person job, sometimes it's a 2-person job. You can also try putting them in a little cardboard box so that they're kind of confined and easier to give. But most cats do not mind this, and most of them will sit content while you give them the fluids. Okay, so with Julius, the area that we're looking here is between the shoulder blades. Okay, so right here. If you're giving large volumes of fluid, sometimes you have to give it here, and sometimes you give it a little further back. Now, after we're done, and as the time progresses after giving fluid, sometimes that fluid pocket will move down a little bit on the sides. That's completely normal. It usually absorbs over several hours. Okay, so now we've got our fluids here. Remember we talked about hanging 2 to 3 feet above the patient. So in this situation, we're a couple feet above. All right, and we're going to go ahead and give the fluids. The roller has stopped the fluids right here, so it's not actively moving. Okay. So what we're going to do is we're going to go ahead, we're going to right between the shoulder blades, we're going to tent up the skin, okay, and we're going to just go ahead and put it in the subcutaneous space. Next, we're going to roll the stopper all the way to the back so that the fluids can start going. Okay, now when we're done our certain amount of fluids, and again, average is usually between 150 and 300 mils for a cat, we're going to go ahead. We're going to put the roller back so the fluids stop. We're going to go ahead and pull the needle out, and we're going to hold our finger over that puncture site for about 10 to 15 seconds. A little bit of dripping out of that site is completely normal and not a big deal. Even a little bit of blood is not a big deal. So once we're done with that, we're going to go ahead We're going to cap off our old needle, take it off. Again, don't put your fingers on touch this because that will contaminate it. And then you're going to put on a fresh needle. This one has a lure lock, so you're able to lock in. And now we're ready for the next time of treatment. Again, always check with your veterinarian on frequency and how much to give, and frequently check in with them and just letting them know the progress, okay? Because sometimes it will change. Sometimes it will become more frequent and sometimes less frequent. Okay, so you can always give us a call, 770-993-6329, or check us out on the web at myalannavet.com. Thank you.